What are the global differences in CF newborn screening? Imagine a world where every baby gets a chance for early diagnosis of cystic fibrosis. But in reality, how countries screen newborns for this condition varies widely. In some places, screening is routine and highly effective, while in others, it's still a work in progress. Countries like Canada and many parts of Europe have been screening newborns for decades. They often use DNA-based tests that look for specific gene mutations linked to cystic fibrosis, especially in populations where the disease is more common. For example, in Canada, the screening program is well established, with about 1 in every 3,000 babies diagnosed early, leading to better health outcomes. In some regions like Quebec, the incidence is even higher, so screening is a top priority. However, in countries with fewer resources or lower disease prevalence, universal screening isn't always available. Cost, healthcare infrastructure, and policy decisions play a big role here. Some countries are still considering whether to implement screening programs or are doing pilot studies. The methods used also differ. Some regions relying on testing for immunoreactive trypsinogen, a protein that's elevated in babies with cystic fibrosis. Others combine this with genetic testing for common CFTR gene mutations, but the choice of which mutations to test for can vary. Panels designed mainly for European populations might miss cases in babies from Black, Hispanic, Asian, or Native American backgrounds because their mutations are different. This can lead to disparities in diagnosis and care. Timing is another important factor. Countries that perform tests more frequently and process samples quickly tend to diagnose cystic fibrosis earlier. Early diagnosis allows for prompt treatment, which can prevent serious complications like lung damage or poor growth. Conversely, delays in testing or processing can mean children don't get diagnosed until symptoms appear, often when the disease has already caused damage. Access and equity are also key issues. Because of genetic diversity, some populations are less likely to be diagnosed early if the screening panels don't include their specific mutations. Efforts are underway worldwide to update screening guidelines to include a broader range of mutations, aiming to improve detection across all racial and ethnic groups. This is especially important in countries like the United States, where the population is very diverse. Finally, economic and policy factors influence how well countries can implement and sustain screening programs. Regions with established cystic fibrosis care centers and follow-up resources tend to have more comprehensive screening. They see the benefits in early diagnosis and treatment as worth the investment. Overall, the differences in cystic fibrosis newborn screening around the world are shaped by disease prevalence, available technology, genetic diversity, healthcare infrastructure, and policy choices. While some countries have made great strides in early detection, others face challenges that limit their screening reach. The goal remains to improve and standardize screening worldwide, ensuring every newborn has the best chance for early diagnosis and better health outcomes. Always remember, for personalized advice or concerns, consulting healthcare professionals is essential.